Hi everyone, welcome to week 7 of your Pharmacy Procedures 1 course. This week we're covering chapter 7, which is all about safe medication administration. So what you're really going to be focusing on this week is what we call an MAR. An MAR is the abbreviation for the Medication Administration Record. And they're going to talk to you in this chapter a little bit about the similarities and differences. But basically, most MARs look very, very similar and have a lot of the same characteristics. So that's what we're going to really focus on. In your textbook on page 78, you will see a sample MAR. What you will notice is that these all have columns of information. So that's the basic general similarities. Now keep in mind that when we talk about medication administration record, this is something that is used inside a facility. So you wouldn't be doing this with a patient at home unless it was a home health person who was taking care of that patient, or hospice, something along those lines. So this is a facility used document. So in this particular document, you've got a column that includes the drug names, the drug dosage, how often they're going to be taking the medication. Usually there's just different places for you to document on here as to when. And you'll see on the one on page 78, it gives a place for you to put what time, what the site was, who did it, who the initials were of the person doing it. So all of that is a way to track what's being done. So again, make sure you look at the one on page 78. There are a couple of sample problems on 79 asking you about that. For example, on page 79 it says, list the second and third drugs and the dosages on this sample record. So the second drug is the hydrodiuryl, and the dosage is 50 milligrams twice a day. And so they put down when that would happen. It would happen at 8 a.m. and 4 p.m. Then the third drug is the ciprofloxacin, and it's 250 milligrams twice a day. This one, however, is going to be every 12 hours, so it's 6 a.m. and 6 p.m. So you can see how, even though both are happening twice a day, they were specified when they should take them. And then as you go through, and after you go through those samples and those problems, the next thing we're going to start looking at is the rights of medication administration. So what are some things that we have to make sure that we do correctly every time we administer medicine? And these are the 6 rights that you're going to see discussed. The first is the right drug. So in other words, we want to make sure that we are using the right medication every single time. Not just the first time, but every time. So we don't want to just assume that that there's nothing that's changed, okay? So we want to make sure that we're using the same drug every single time. Keep in mind that a lot of times if a drug's changed, manufacturers, whatever, it might look a little different. So you want to make sure you're verifying that. The right dosage. So first you want to make sure, does this make sense? We talked about that before. You don't want to be giving 4, 5, 6 tablets, things like that. So you want to make sure that the dose makes sense. If it doesn't, that's when you want to start asking questions. Anytime you have a lot of decimal places, that's a concern. There might be something going on as far as the dosage being incorrect. So those are just a couple of things to take a look at when we talk about dosage. When we talk about routes, that means how the medication is being taken. Are we taking it orally and swallowing it? Sublingual means, does it go under the tongue? Drops, eyes, ears, nose drops. Topical, so like creams and ointments. So how is it supposed to be administered? Is it inhaled? Is it a suppository? All of those things are things we want to make sure that we understand when we're ready to administer the medication. These are just a few others. Transdermal, it goes on top of the skin. Parenteral routes is when you're doing something that's not going through the digestive system. So typically we think of it as IV, but it doesn't have to be an IV. It could be intramuscular, subcutaneous, intradermal. The idea here, though, is it's not passing through the digestive tract. So you want to make sure, however, that you're doing it properly. And then finally, we have the right time. Keep in mind that in most institutional settings, we are going to be using military time. So everything is going to be based on whatever, 01 is the 1 minute after midnight. And we go all the way to 23:59, which is 11:59 p.m. before the next day at midnight. So, making sure that you understand military time, if that's what's being used, is very, very important. Obviously, we want to make sure that we are giving our medication to the right person. So that's where it comes in, checking IDs, checking, birth dates, things like that. We don't want to skimp on that because that's an easy way to make a mistake. And then, of course, documenting what happened. So when we do an actual medication administration, we need to document it afterwards, not before, but after. And then keep in mind that that patient is going to be your best source of information. For example, if a patient says something like, my medicine wasn't that color yesterday, maybe my tablet was bigger or my tablet was smaller. Those are some real clear indications that there might be something wrong. So that's a good way to start the process of checking to see what might have happened and if there is an error. And then anytime that there is an error, it can happen at any point in this process. Make sure that it's reported properly. We do have certain things that we're not supposed to do as far as abbreviations and things that help to prevent some of those errors. But if there is an error, make sure you're following the protocol to report it and what you do to prevent it from happening in the future. If at any time you have questions this week, please make sure you reach out to me and have a great week.